Good evening. I'm Selwyn Collins, your host of CWS Conversations with Selwyn. Thank you for joining us. And those of you who are joining us for the first time, a very special thank you to you. CWS is about having conversations with people about their journeys and how are they using their gifts and talents to help others. So I'm always looking for people who are doing extraordinary things, or I would say doing things extraordinary well. I believe that each of us has a story to tell, and it is by sharing our stories, talking about our successes, but also our challenges and how we might have overcome them, and how often we get up when we fall. I think these stories really speak to us, speak to our humanity, and help us to connect and help each other. And so I often ask my guests, imagine a young person, boy or girl, somewhere in the world, listening to you, listening to how you overcame some of your challenges, and being inspired to overcome theirs, to step beyond their limitations. Now imagine that person growing up to becoming a head of state, or someone who stops a genocide, or someone who discovers a vaccine that saves millions. We do not know. And I think the true essence of our humanity is being able to give beyond ourselves, to give without expectations, without placing demands on the receiver. That to me determines who we are, our character, who we are as people. I'll take a short break, and when I return, I'll introduce you to our guest tonight, Dr. Frank Denbow. We are back. Those of you who are joining us for the first time, I am Selwyn Collins of CWS Conversations with Selwyn. Just hold me a second. The gentleman you see next to me is Dr. Frank Dembo. Frank, good evening, sir.
Good evening, Selwyn.
And
Good evening, listeners.
welcome, welcome. Let me just run through your bio quickly and get the show started. Attended St. Ambrose Primary School, passed common entrance in 1967. Attended Queen's College from 1967 to 74. Attended Queen's University Belfast, 1975 to 1981. Graduated as MD 1981. Internship Waveney Hospital 1982 to 1983. University Hospital of the West Indies Jamaica Residency 1983 to 87. Several attachments at hospitals in the UK 1987 to 1989. Membership of the Royal Colleges of Physicians 1989. Attending physician and senior lecturer in medicine, University of Guyana 1989 to 1991. Chief resident of Newark Beth Israel Hospital, Newark, New Jersey 1997 to 1998. And executive health exams international 1999 to present. Frank, thanks very much for coming and sharing your time with us in CWS this evening. What inspired you to want a career in medicine? And when you think of health, what is the first or what is the one thing that always comes to mind?
Well, my father showed me a picture in when I was 5 years old, with me holding my mother's medical bag, and I think that his dream was for me to be a doctor. And in retrospect, I think he probably brainwashed me into wanting to become a doctor. My mother was a tremendous example and role model. I admired the way her patients respected her and loved her, and she loved them back. Uh, I saw what being a doctor was all about. It wasn't about necessarily about prestige. It was about doing whatever you can to help people who are suffering. And I think that it was she who inspired me and my father who encouraged me to believe that I too could be a doctor. And I think that's where it all came from.
Um, can you give us a historical perspective of the Dembows? What can you tell us about the origins of your family?
Well, um, the the Denbows, from my recollection, two brothers came from Antigua to British Guyana round about, I think it was the 1860s.
Hmm.
Uh, they both were teachers. One was G.C. Denbow. I'm not sure um, what the G and the C were for. The other was Claude Hicks Augustus Denbow, and they were schoolmasters, I think, in Firish, in Berbice. Um, Charles Hicks Augustus had six children, uh, one son and five daughters. The son eventually was, that was my grandfather. He was Charles Egerton Denbow. He was a policeman, and he rose to the rank of Chief County Sergeant Major, which at the time was the highest rank that a black Guyanese could reach. Um, he was a rather portly guy, and the story was that he had a phenomenal memory. At the time, the police force had about 200 people under his charge, and it was said that he could remember the names, rank, and where they were stationed of every single member of the police force under his command. He truly had a tremendous memory. Um, he married he got married to my grandmother. Apparently, it was his second marriage. His first wife died in childbirth, and we have a family picture. At the time, he was a corporal. I think this was 1907. We have a picture of the wedding. It took place in Maikoni, and he had the top hat and tails. Um, uh, Clearly remnant of the colonial thing, but it seemed that the entire Maikoni village was at the wedding. There's a wonderful picture there. That union produced five children, two boys and three girls. One of the boys was my father, Frank Holstein Denbow. The other boy was Claude Hicks Augustus Denbow, who later on became a dentist. And the three girls were Nora Denbow, later Nora Liverpool, Phyllis Denbow, Phyllis Crawford, and Gwendolyn Denbow, later Gwendolyn O'Mallow.
Wow. Um, do you recall any special words of wisdom from your parents when you were a child that have shaped who you are today?
There are so many. One of the things that was always stressed was to always be generous and caring about others. Um, Most people think that we were the Denbows had golden spoons in their mouth, but we didn't start off like that. My mother, for example, both her parents were deceased by the time she was 18, and my father lost his father when he was 16 years old. So there were tough times, but hard work and determination is what saw them through. I mean, back in the 1930s and 1940s, it was not a walk in the park.
Mm-hmm.
but they worked hard and eventually reaped success.
I want to explore your timeline a little bit, um, early timeline. Give me a glimpse, or give us a glimpse of the 7-year-old Frank, Frank at 15, Frank at 24, and who Frank is today.
Well, at 7 years old, I was living in Transport House in Urquhart Street, which is um, just near to where the Woodbine Hotel was, and that's going into Tiger Bay. So it wasn't actually Tiger Bay, but Tiger Bay was just um, 30, 40 yards away, where German's restaurant is today. That basically is where Tiger Bay started, and we were just on the other side of that, sort of like the continuation of Lamaha Street. And living in Urquhart Street in Transport House at 7, at the time there was the 80-day strike where the public servants in Guyana went on strike, and as a result, they had no income, and the unions had to organize food trucks, which would come to the yard and transport house, and people used to have to line up for plantain and for rice and certain basic foodstuffs, because they had no income and no money to buy any food. And as a 7-year-old, I was, I had a first-hand view of that, and it had a profound effect on me, where I saw people fighting for food and that sort of thing. It really was. It might have been a little traumatic, but I think that it taught me the value of a job and the value of working hard and to ensure that everybody had a seat at the table. And I think that had a significant impact on me growing up.
Looking back, oh, well, actually, sorry, the 15-year-old Frank, and the 24, and then who Frank is today.
Well, at 15, let me see. At 15, I got into the sixth form at Queen's College at 15. I did reasonably well at O levels, and as a gift, I got the permission to drive my father's car, which you can imagine at that age was a huge deal. It allowed me to have all my friends drive with me and cruise around Georgetown. So it was a lot of fun at the time. You give a 15-year-old the keys to a car, and you know, I had some good times. Shortly after that was one of the most traumatic events in my life at the time, when one of my best friends got killed in a car accident, Mickey Chandaban, and from Buxton. And it's something that here was a young man with tremendous potential. He wanted to be an engineer, and he was dead before he was 18 years old, and that has lived with me ever since. After I left Queen's College, I went to medical school, and I graduated from medical school. I think I graduated at 25 years old from medical school.
You know, I'm curious about something. When you mentioned where you live in proximity to Tiger Bay, an impoverished neighborhood, so to speak. Do you believe that that contrast with your privileges, you were allowed to drive your father's car at age 15. You went to one of the top schools in the land at the time for boys, Queen's College and so on. Um, did you think that contrast in terms of income or access had an effect on you growing up?
I'll tell you a funny story.
Mm.
Um, when I was 6 years old, I think, um, I went to a private elementary school, and it was named Stella Maris, and it was near where the Pegasus is today. It was in Kingston, and the the people who went there were privileged people. My parents noticed that I started to develop an attitude of arrogance and snobbishness. And they decided that they did not want a child to have that type of attitude. So they yanked me out of that school and sent me to St. Ambrose. And I think that was the best decision they've ever made. I quickly realized, I started to realize who I was and that I was no better than anybody. And as a matter of fact, my mother told me this story about 20 years ago. And she was teasing me and laughing at me. And I had absolutely no idea that at 6 years old I was a snob. Uh, and I think that it shows the kind of parents I had. Today we see children of privileged people here in the United States who are allowed to do all sorts of ridiculous things. And the parents feel that, their children, they can allow them to do that. But my parents would not allow me to behave that way. And I think that I really am grateful that they made those decisions.
What are some of your favorite or fondest memories of them?
Well, my father, he loved me like nobody else could. He wanted me to be successful in absolutely every area of life. I remember when I started in the fourth form at Queen's College, we were allowed to wear long pants. And as you know, when you're 14 years old and you have to wear short pants, it's difficult because you go out of the school and the prevailing attitude is, oh, you're a little boy. So the first half term when I was allowed to wear long pants, I brought last in the class. And my father was extremely upset. And because he loved me so much, he could not bring himself to take part in any sort of corporal punishment. And he delegated that duty to my mother. But she was a disciplinarian, and after that episode where I brought last in the class, I never brought last again.
You never did.
Never did.
So who would you say, outside of your parents, has had the greatest impact on you as a child?
I had cousins who were outstanding students, outstanding cricketers, and they were my role models.
Mm-hmm.
Um, Having no other siblings, it was mainly my cousins. I am significantly younger than the rest of my cousins, and I looked up to them, and they were quite successful. Medicine, law, in the military, pilots, that sort of thing. So I think that they were a great example to me.
Um, I'm going to ask this question, but we'll answer it after the break. We'll take a quick break. About when do you believe you were first introduced to the idea of responsibility, of community improvement? We are back with Dr. Frank Dembo. Frank, the question I asked before the break was about when do you believe you were first introduced to the idea and responsibility of community development?
I would have to say in the early 1970s, um, my my mother had a project to start a library at the hospital, the medical library, and they had fundraisers to raise money for that ball, for the library, fundraising balls, and they used to call it the dropout ball, where adults who seemed at that time to me to be quite elderly would dress up in school clothes and go to a party. This would have been round about 1970, 1971. And they raised money, and they were able to build a library at the hospital, which was quite an achievement. So that I would say would be the first exposure I had. The second exposure was shortly after that with the Uncle Eddie's Home for the aged. Eddie Halford was a very good family friend of ours, and he was a mortician. And of course, that is a job where you're never unemployed. He was a mortician here in Brooklyn, I think, and the Burnham government donated the land, and he donated extraordinary amount of money to build that home. And my parents were, particularly my mother, worked very hard to start the Uncle Eddie's Home. So those two things I would say were the first two things: community help and development.
And you have this passion for helping others. We talked a lot about it before the show and so on. What do you think was the trigger for that? I mean, you've mentioned a lot about your family and the kind of principles that that your both of your parents sort of instilled in you, especially your mom. But what was the trigger that started this desire to help others? And did you go into medicine with that in mind?
Yes, I did. I think it was her example. There's no question about it. When you see somebody who works so hard, and people find that she's done so much for so many people, and the whole attitude of what a doctor really should be like. You can't help but admire. It's some of the best qualities that one could aspire to, and I think that she has been a great inspiration to me. And even though she was a great inspiration, it took my father's encouragement for me to believe that I had the capability of of attempting to follow in her footsteps. So I think that without a doubt, they were tremendous role models and helped get me started in that field.
You became an MD at 25. Um, can you tell us what challenge in let's take medical school, what challenge you have overcame that you're most proud?
Um, well, when I started in medical school, the big challenge I had was loneliness.
Hmm.
I was outside of my culture. Um, growing up in Georgetown, temperatures in the 70s and 80s. Here I was in an extremely cold environment. Uh, there were there was one other West Indian. He was Trinidadian, and he was much older. He was doing a degree in a master's in industrial engineering or something like that. But I had no other West Indians around, and it was my first time away from home. And loneliness was really my biggest problem. Uh, Loneliness and the cold. Um, in the United Kingdom, there's a certain coldness in the air that you don't escape even when you're in your room. Um, what I noticed in the United States is it doesn't matter how cold it is outside. When you're inside your apartment or house or whatever, you're very warm. There, you were in your house and you were cold. You had to be wearing sweaters in your house, and you know, I think that the combination of loneliness and the cold were my biggest obstacles.
Let me just shift to the chat room a second. Anonymous said, "What was the French song that was being played before the show began? French Africa or French Caribbean?" Oh, and it's French Africa. Other person, increase your volume, please, and thank you. Okay. And Anonymous said again, "I remember the dropout balls. We even copied the name and had a dropout ball at St. Rose's." Um, Frank, what is you've gotten a lot of advice from your parents, encouragement from your, especially your dad and so on, and I guess other family members. But then there are people that we run into who sometimes might discourage us, not necessarily intentionally, or even, but sometimes they end up doing so. What is the least helpful advice anyone has ever given you?
I think that one should always allow people to attempt to fulfill their dreams.
Hmm.
Um, One of the things that I'm cognizant of is when you're in high school, for example, at age 13, 14, 15, not everybody is mature at that age. And there are lots of people who are very bright, but who are unable to focus. And as a result, they may not do particularly well academically at that point in time.
Hmm.
But that is not a reason to feel that they cannot achieve. And I think that um, there are several students, that I saw in my high school days who had the ability. It's just they didn't have the maturity at the time to focus on their academics or whatever. And unfortunately, some teachers who maybe didn't have the sort of experience that they should have had felt that those students were incapable of achieving. And there's so many students who did not do well in their teenage years who blossomed in their 20s and 30s. And this is one of the fantastic things about the United States, where you have a second, third, fourth, fifth, sixth chance to reinvent yourself and be successful. So I think that the rush to judgment, where people are being judged and they're 13 years old, I think that is unhelpful.
Any advice for young students aspiring to enter the field of medicine?
Well, I think that, and I've said this several times, if you want to do medicine, you should want to do medicine for good reasons. You shouldn't want to do medicine so that you could become rich or famous or prestige. You should do medicine because you care about people. And I think that I was involved in Guyana in 1989 and 1990 with interviewing prospective medical students. I was also involved in interviewing prospective medical residents here in the United States in 1997. And I think that what I focused on was why did they want to do medicine and why did they want to become doctors? Because most of the people who start in medicine are bright enough to do medicine. We had, I would say, for example, when I was at Beth Israel, we had over 1,000 applications for 11 jobs. And we interviewed about 120 people. And absolutely all 120 people were adequately qualified and intelligent and smart enough to become, top-class physicians. It was a question of, did they have the right attitude? And I think that we should focus much more on that than the people who are extraordinarily bright. Because being extraordinarily bright does not necessarily mean that you'll be a good doctor.
What are some of the most common types of problems you see in your field?
Well, the biggest problem, I think, is there are lots of misperceptions about various illnesses. A common misperception, for example, and one which I'm very passionate about, is that women don't get heart disease. Heart disease kills 5 times more women than breast cancer. And therefore, whilst I applaud the emphasis and the awareness that is brought to bear on with regards to breast cancer, I think that too many women do not understand or recognize the fact that heart disease kills a lot of women. And if one looks at the statistics, you will see that the results of heart attacks in women are much worse than they are in men. And women still do not get as good treatment for their heart attacks as men do. And heart attacks in women are also much more difficult to diagnose. They don't present in the classic way that heart disease presents in men, the way heart disease presents in men. So it's more difficult to diagnose, and it has a worse outcome in women than in men. And I think that's a very important thing to know. Another misperception is that, for example, cigarette smoking. Most smokers and ex-smokers, if you ask them what is the commonest medical problem that cigarette smoking causes, they would tell you chronic bronchitis and emphysema or lung cancer, when in fact it is heart disease that is the biggest problem, medical problem from cigarette smoking. So those are some of the things that I think that need to be um, in the public domain for people to know about and understand.
I love to follow the flow on this show and go wherever the conversation takes us. Talking about some of those medical misconceptions and so on, can you give us some simple health tips?
Well, I think that everybody should have their blood pressure checked at least once a year. Once you're over 30, you should have your blood pressure checked. Um, High blood pressure is what we would call a silent killer, in that people who have dangerously high blood pressure do not necessarily have any symptoms, so that people will be feeling great and have dangerously high blood pressure and they have no clue. And unless you have your blood pressure taken, you would not know about it. A lot of people think that if you have high blood pressure, you will get a headache. That is not so. So a very important thing that people should do is have their blood pressure checked at least once a year. And that is a very simple thing. It's non-invasive. It doesn't cause any pain or discomfort. And there are lots of healthcare providers who can do blood pressures for free. A lot of pharmacies have that facility. And certainly a lot of offices have trained staff to take blood pressures. I think that is a very important thing. And unfortunately, I've seen one of my schoolmates had very high blood pressure. He had no idea, and the result was devastating to to us, all his friends, and something that I think that it's a fairly straightforward and simple test to do to have your blood pressure taken, and it's not expensive. In a lot of cases, it's free. Um, Another important source of problems is obesity. Um, and what I have found is that one of the most important measurements in obesity is the waist measurement. Um, because we find that if a man has a waist measurement that is greater than 40 inches, and that's taken at the belly button, and a woman over 35 inches, those people have a significantly increased risk of heart disease. So that's a simple measurement that anybody could do. Um, and if your waist measurement is above 40 as a man or 35 as a woman, I think you should start working to get those numbers lower. Uh, Men should have their prostate examined. This is a very dicey topic in that most men are quite uncomfortable with having that procedure done. It's most of the discomfort with the rectal exam is largely in the minds of people. It's not that painful or uncomfortable. It might be humiliating to some people, but I think it's important and potentially life-saving examination, um, because I think that having a prostate exam as well as doing the blood test, the PSA, the combination of those two things have the advantage of detecting prostate cancer at a very early stage, and hence can save lives, because we find that the incidence of prostate cancer is extremely high in the African American and Afro Caribbean community. Uh, I saw a study where, for example, in Jamaica, the prevalence of prostate cancer is actually off the charts. And that is clearly something that we could reduce the morbidity and mortality, that is, the illness and death from this dangerous disease. Colon cancer is another preventable disease in the sense that the colonoscopy is an extremely useful test to detect and prevent the disease from progressing. The problem with colonoscopy is it's extremely expensive. It's over $1,000. And if you can have a colonoscopy every 7 or 8 years, you're pretty much guaranteed that you're not going to die from colon cancer. There's a lot of, obviously, the cholesterol is something that everyone is sensitized to. The numbers are there, the total cholesterol, the good cholesterol, the bad cholesterol. I don't want to get too deep into that, but there are several, I think those are some of the major things. And of course, diabetes is a very common disease, and the most important thing about diabetes is that if you have good control of your diabetes, then you can live an absolutely normal life in terms of quality of life as well as quantity of life. But you have to be extremely disciplined when you have diabetes, and that's not always easy.
Frank, let me shift to the chat room a little bit. I see some people have been making some comments. Karen G said, "Great to hear you talk about heart attacks in women. This needs to be really addressed in our communities." GT Girl, isn't that partially the fault of the physicians that so many women die of heart disease because they sometimes brush off non-specific symptoms that women report as being just in the head? And then GT Girl said again, "Please address metabolic syndrome." Karen G said after that, "High blood pressure, diabetes, obesity. Please help our people understand this issue. Please tell us to eat better and move more." And GT Girl said, "Volume, please." I think the volume is high. Check your computer volume. And Karen G again, "Why do you think it is so high in our community? Any known issues with our environment or diet or genetics?"
Well, that's a potpourri of questions.
Yes. You want me to go back from the beginning? And
One of the things that when it comes to heart disease in women, I think that there is a red dress campaign, and the company where I work, we are deeply involved in that. But it's difficult to I do agree that the medical profession should take some of the blame for this.
Mm-hmm.
But the reality is, it is difficult much more difficult to diagnose heart disease in women than it is in men. And I don't say that as an excuse, but I think that many women, for example, are the caregivers in the family. And they tend to worry more about the other members of the family rather than themselves, and therefore are less inclined to seek attention. So, for example, if a woman develops indigestion for the first time in her 50s, it's unlikely that she would even contemplate the possibility that this is a manifestation of a heart attack. And I've seen several examples of women having what sounded like indigestion, and taking antacids, and going to I have a specific case in mind where the woman had developed indigestion. She was actually 47 years old, and she was obese. She developed indigestion, was taking antacids. It didn't help, and she went to the emergency room. And in the emergency room, the doctor gave her stronger antacids, prescription strength stuff, and sent her home. And it was only when she collapsed and was brought back to the emergency room 3 days later that an electrocardiogram was done. And then the diagnosis was made, and she ended up having stents put in and bypass surgery and all this kind of stuff. But I think that one has to be aware of the risk factors that are present. And I think that if people are, and hopefully with the healthcare, Obamacare coming on stream, people will be able to get the quote-unquote wellness exams, and where one can identify risk factors so that people are much more aware of their particular circumstance, so that they could take the necessary steps to improve their general well-being, so that they can modify those risk factors.
Other person said, excellent comment, GT Girl. I just had that discussion with someone, perception, misconceptions of diseases in women. And Karen G asked, why is prostate so high in our black men?
I wish I knew the answer to that. I remember teasing you a few months ago as to why fibroids are so common in black women. I'm not sure why prostate cancer is so common in the African American and Afro-Caribbean communities. The question always is it dietary related? Is it environmental? Is it genetic? I really don't know. The bottom line is that it's common, and what we need to do is to make sure that we're doing everything we can to reduce the prevalence of advanced prostate cancer. So early detection is extremely important. Having annual rectal exams and annual PSAs is definitely the best methodology for reducing mortality from prostate cancer.
And I'll read another question from the chat room. Then we take a quick break. When I return, I want us to talk a bit about community development and this organization, this association you started. But what I would like to ask of you is, and simply because it seemed to be, we can't ever get enough information and advice about our health. And so, what I would like to do, the last 10 or 15 minutes of the show, we get back to medical tips. But I want, after the break, to address the community development and some other issues. Is that okay?
That's fine.
All right. So, GT Girl said, asked, genetic predisposition. Given that predisposition, the environment, diet, and exercise may develop whether or not that person develops heart disease, high blood pressure. Um, I'm not sure. I'm not sure I'm reading this right. Given that predisposition, the environment, diet, and exercise may develop whether or not that person develops heart disease, high blood pressure. There's a question mark at the end, so I'm not sure. GD girl, please.
I think what she's alluding to is the fact that regardless of whether you are genetically predisposed to a particular problem, it is your how you operate in terms of cigarette smoking, proper diet. The risk factors for heart disease are basically hypertension, high blood pressure, 1, diabetes, 2, cigarette smoking, 3, obesity, 4, family history of premature or early coronary artery disease, and that is people having heart disease before age 60, whether it be your parents, your siblings, or your parents' siblings. And finally, your cholesterol profile. So if you look at those 6 things, the only thing you can't change is the family history. But the other 5 things, you can have an impact on them and therefore reduce your own personal risk. So if your blood pressure is high, first of all, you have your blood pressure taken to know whether it's high or not, as I pointed out earlier. So if you have diabetes, make sure it is as controlled as possible. Cigarette smoking is definitely not a good idea at all. Obesity, you just got to lose weight. And as I mentioned before, the waist measurement is particularly important. And the 5th one is the cholesterol profile. One of the things that we have, with respect to cholesterol, because there's a whole lot of people tend to focus on cholesterol as if it's the only thing that matters. The reality is that we have found over the last 20 years or so that it is not just the total and bad cholesterol that are important. It's the good cholesterol. You want to have as high a good cholesterol as possible. And the medications that are commonly used, the statin drugs, have a very limited effect in terms of raising the good cholesterol. The good cholesterol tends to be raised by exercise and certain foodstuffs. Things like fish oil, oatmeal, walnuts, avocado, particularly the bigger, smooth ones from Florida. Those are some of the things that help to raise your good cholesterol. And, if somebody has a good cholesterol of, say, 80, as opposed to another person having a good cholesterol of 30, and the other numbers are the same, the person with the good cholesterol of 80 has a much lower risk of developing heart disease than the one with the good cholesterol of 30. So I think that we have to, in addition to diet and exercise, we have to think carefully about how are we going to monitor and change our cholesterol profile, not just by that. And one of the things that I've noticed is that some people feel that once they take the statin drugs, it means that they could eat absolutely everything and anything at any time in any amount. And I think that's the wrong approach.
Let's take a quick break. When we come back, I want you to tackle this question. You started an association called the Guyana Jamaica Friendship Association, New York
That's
Inc.
correct.
If you can tell us when we come back about what you expect this association to accomplish, and why you started it and so on.
Okay.
All right.